right, well, welcome back to my channel. Today we're going to talk about genetic testing. Genetic testing is becoming much more common. Today we're going to talk about who should be tested, when they should be tested, and why they should be tested. If that sounds good to you, please continue watching. Well, welcome back to my channel. My name is duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about teaching women how to improve their lives, and I believe that begins with great health. If you're new here and you haven't subscribed already, please press the link below to be able to get notified when a new video comes up. Well, today we're going to talk about genetic testing. Well, first we're going to talk about who should be tested. So if you have a family history of breast cancer under 50 or personal history of breast cancer under 50, any ovarian cancer. So when I was in training, we used to only test patients with ovarian cancer who were, we thought, high risk, meaning they were younger than 50. But times have changed and we know so much more now about ovarian cancer. So now we pretty much test anyone with ovarian cancer. And I think that's very important. If you've had a family member that maybe wasn't tested, because it was many years ago before we started universal testing, then definitely if they're still alive and wanting to be tested, that would be great for them to go ahead and get tested. Anyone with pancreatic cancer, anyone with a family history of male breast cancer, or a personal history of male breast cancer, anyone who's triple negative, a patient who has Ashkenazi who has had breast, ovarian cancer, or pancreatic cancer, anyone with metastatic prostate cancer, a family history of a genetic mutation. Those are people that should be tested for genetics. Now, what is genetic testing? So it's very different than what some people may think. It's super easy. It's just a blood test or a saliva test. And what it is, what we're looking for is there any mutation in the genes that you get from your mom and dad that puts you at high risk for cancer? A lot of times, we think about, preventing cancer, but we do know there's some families that are at such high risk of cancer that if we can kind of pick out those patients and then follow them carefully, hopefully we'll be able to prevent cancers in patients. And so when you think about genetic testing, I like to think of it as, one tool to help us get a step further in preventing cancers. So after you've talked to your healthcare provider about genetic testing, or after you've actually thought about genetic testing for yourself, definitely speak to your healthcare provider. Now, I have had some patients get tested from many different sources. There are some online testing, but I do prefer a test that's ordered by your doctor, because that will be more clinically relevant. The tests that are direct to consumer are getting better, but still there's certain tests that as a provider, especially as an oncologist, that I prefer. And so those are the ones we're going to talk about today. Now, also in terms of when to test. So I will have some patients that maybe, they just found out they had a BRCA mutation. They have like a daughter and they're like, when should my daughter get tested? I tell them that children should not get tested until they really understand the purpose for the test and the ramifications of the test. So let's say your daughter or son has a gene mutation, if they're not able to understand what that test means or what are the consequences of having an abnormal test, then they're really too young. We try not to test like for BRCA until the patient is at least over 18 and can have kind of a informed discussion on what the test is and what it means. And I actually tell my patients too to make sure that if their children are getting tested, that they have life insurance first. So those are some things that I talk to my patients about that I think you need to think about before getting genetic testing. Now, of course, testing is very easy. Again, it's just a blood or saliva test. Some of the companies that I commonly use are these three here. So I use Myriad very often. They are one of the largest company and pretty much the first to market. They do an excellent job. And so sometimes I'll use them, but there's many different companies now that are available. I use Invitae a lot. They have very good cash-based services. So I do have some patients that may want testing that may not fit the insurance criteria. And so a lot of times if I know it's not going to fit, but they're adamant they just want testing, then I'll use Invitae a lot because their cash prices are very good. When I was in training, the testing was close to like $3,000, and now it's just $100 or $200 depending on what company you use. So it's much, much less. And the test also varies depending on what test we order. So if there's a known family mutation, you don't really need to be tested for every gene. You need to be tested first for that gene that's in your family. And if that's negative, then most genetic counselors will do what's called reflex testing and then test you for other genes. But if there's a known mutation, it's kind of more cost effective to first test you for that. But a lot of times now we're doing what's called panel testing, where we're checking for a large number of genes that we know cause certain cancers like breast cancer, ovarian cancer, colon cancer. Another company I use a lot is Ambry. They do a very good job as well in terms of giving very good data and very good results. So testing depends, on the insurance, on whether I think the patient's going to have to self-pay or not, because insurance may or may not cover it, even though you might meet all the criteria. So I do tell patients, if insurance doesn't cover it and you really want the test, there are, ways that you can, pay for the test on your own, especially in the United States. Okay, so we talked about what is genetic testing, who needs genetic testing, what test do you order? And then I'm going to talk about counseling. So counseling is really important. So one of the things that, I want to make sure patients know is that you really should have pre-test and post-test counseling. Pre-test counseling is just when someone sits down and just tells you, okay, this is what the test is, and these are some of the outcomes that may happen. I've had patients, over the years that'll, go get a mammogram, and their mammogram center will just say, oh, you have a family history, you should get genetic testing. The patient doesn't really understand, what that means. There's no counseling. And so I kind of discourage that, but it does happen. And sometimes I see them and they're coming to my office for a consultation and they're like, well, I have this test, I don't know what it means, or I've even had patients that get tested and never know what the results are. So, I discourage those centers, but it does happen. So we're just gonna, deal with real life here. The other thing is post-test. So after you've been tested, your blood or saliva has been taken, then you need to be counseled on the results, whether they're normal, whether there's a variant called a VUS, variant of uncertain significance. A lot of times I'll tell patients, sometimes the big companies that do this a lot, they'll reclassify variants as new information comes about. So, they may contact you or you and your physician, years later saying, oh, you had this variant test. Now we know that it's, may be cancer causing. So they do sometimes what we call is reclassify variants from time to time. So I tell patients that, the bigger companies will contact you and your doctor to let you know if the variant's been reclassified. So that's why I think it's important to have post-test counseling. Not only do we just go over the results, but, what are the implications of those results? And if you are positive, I talk to patients about, sharing that information with their family members so their family members can get tested. And again, if there's a family mutation, a lot of times that particular gene can be tested for first. It's much less expensive. And then we do kind of reflex testing, where if there's a known mutation in the family and someone else is tested but it's negative, then we'll still do the full panel testing. It's kind of complicated, but it's not really that complicated, but I wanted to make sure that you kind of understand some of the terminology. So if someone's talking to you about the genetic testing, I want to just make sure that you have someone that can counsel you so that you understand the test, why it's being ordered, and then after you get the results, someone can go over it with you. Now, in my practice, I do see a lot of patients with BRCA mutations, syndrome, and most of the ones that are kind of ovarian cancer related, I'm very comfortable with. But there are some really rare genetic syndromes that I don't see very often. So a genetic counselor is a very good person to see if your healthcare provider maybe doesn't understand the test results, because sometimes they're very complex for certain gene mutations. So, from time to time, I'll have a family that's very complicated and I'll say, I usually do the traditional ones, but your family may be more complex. And so I'll send them to one of my local institutions in the medical center here in Houston, where they can see a genetic counselor, because genetic counselors, this is what they do all day long. I have special interests in this, so it's very fascinating to me. So I have educated myself over the years, but there are some things that I do send patients to a genetic counselor because I think it's very important. My goal is just to make sure the patient gets to the right person so that they can get the best information that they need for them and their families to make an informed decision. The other thing that I forgot to mention that I want to make sure I talk about is that when you get testing, and the tests that I mentioned, whether it's Ambry or Myriad or Invitae, these are all clinical grade next generation sequencing tests. And so, there's a lot of companies that do testing, but you really want a clinical grade next generation sequencing tests. And a lot of the big companies that I mentioned will do that for you. So just make sure that if you're getting tested, that it's the appropriate test. I have had some patients that have gotten, some of the online tests that maybe aren't clinical grade, and sometimes I'll just repeat their tests. One thing also, I've had from time to time over the years patients that maybe gotten tested, before many years ago, like before 2013. The testing has gotten better every year because we're doing more tests, we're learning more information. So if I have someone that got tested before 2013 and I'm not quite sure if they really have a mutation in the family, especially if there's a strong family history of cancer, then a lot of times I'll retest them just because the tests now are so much better than they used to be, in the early 2000s or even the 1990s. So that's another thing to keep in mind. Even if you had a negative test in the 1990s and you have a strong family history, think about getting retested because the testing is much better. There's a lot more genes that we understand more. We understand our causes of cancer, especially ovarian type cancers and breast cancers. So if your testing was a long time ago, then that might be something to talk to your healthcare provider. Well, I hope I didn't confuse you. I hope I made that clear. So today we talked about genetic testing, who needs it, how to do it, what type of test did you get. If you feel like you have a strong family history of cancer, definitely talk to your healthcare provider to see if genetic testing is right for you, to see if it's something that they recommend for you. I hope this has been helpful. I hope this video helps you to get closer to reclaiming your life. If you have any questions or comments, please put them in the comment section below. And thank you for watching, and I'll see you next time. Bye-bye.